Assalamualaikum everyone. Okay, so I'm here with the third video of revision relating to the PRC 5, that is the ITB of examining body of ICAP. So now we are moving towards the pharmaceutical industry relating in Pakistan. Let's just quickly go through the pharmaceutical industry and let's have a quick overview of what pharmaceutical industry and how basically the pharmaceutical industry works around the economic conditions of Pakistan. So over here it says that uh, the pharmaceutical industry, Pakistan has very vibrant and formal looking pharmaceutical industry. So we have got good pharma industry operating in Pakistan. That is something which is good. And there are approximately 650 companies. Now this is something which is important. 650 companies पाकिस्तान में ऑपरेट कर रही हैं in Pakistani pharmaceutical market, out of which less than 30 are multinational. So this means that out of 650, if I count, let's suppose if 30 are multinational companies, this means that multinational market is also considering the pharma industry in Pakistan to be a lucrative one. फिर उसके बाद हमारे पास आता है the pharmaceutical industry contributes approximately 1% of the GDP. You know it very well that the contribution of pharmaceutical industry in Pakistan is 1% of the GDP annually, which is quite a big number. Today, Pakistan has about 759 pharma industry manufacturing units, including those operated by 25 multinational present within the country. So let's just quickly jot down some of the most important information. There are 650 companies, pharmaceutical companies operating, out of which around 25 are multinational. I'm assuming that this figure given in your book is 25 being the correct one, right? And it contributes around 1% of GDP. Along with this, Pakistan pharmaceutical industry meets around 70% of the country's demand of finished medicine. So we are not importing medicines to a greater extent. We are fulfilling 70% of the demand within our country. That is something good about an industry, because this means that the industry of pharmaceutical is quite mature and they know that how to contribute to the industrial demand of a specific need, right? And then over here it says that the pharmaceutical market in Pakistan is estimated by IMS, MAT, June 2017. Now, IMS is most probably the industry or the let's suppose the government organization which is basically running after the numbers of pharmaceutical industry at a 300 billion rupees, growing at a rate of 12% 5 years. 5 years contribution. If we look, this means that the pharma industry is growing at a rate of 12%, and there are 300 billion rupees of work being done in this industry. This industry is dominated by national and local companies, which accounts for 2/3 of the market share, whereas multinational enjoy the remaining 1/3. Okay, so and the best part is that it evolves around a total estimated market of rupees 300 billion, and the annual growth of this industry is around 12%. If I compare the last 5 years figure, it's a very, very huge, massive growth. And if I consider that there are 2/3 of the market share is being taken by the local companies, as I have suggested over here, that the local companies accounts for, and there are total 650 companies, out of which 25 are multinational. So this means that 625 local companies accounts for 2/3 of the market share. However, still the market share is dominated by the 1/3 ratio, which is in number quite less. But this means that the foreign industry, foreign companies have more dominance of market share if I look it as in terms of numbers. So yes, this is something which is different. Then if I move forward, then if I move forward, it says that Um, top 10 companies constitute approximately 46% of the market, whereas the top 50 share approximately 90% of the market. So this means that the top 50 companies makes 90% of the market, and the remaining 600 companies makes 10%. This obviously there are certain giants within the industry, and you know it very well that these giants, if they're working, it's same as the Unilever and Procter and Gamble. They are considered to be the giant of their industry, so they may be contributing around 60 to 70% of the entire market. That is the good oriented market. But in comparison, if I look at the pharmaceutical industry, it is very evident over here that for 90% of the market share is being taken by 50 companies only, and the remaining 600 companies takes cumulatively a 10% of the market share. Then over here it says that the top 10 companies, if you look at the top 10 companies, GlaxoSmith, one of the best companies in order to work for audit related tasks. It's a multinational. Gets Pharma, national companies. Semi Pharmaceutical Limited, private. Down you can see these are all private limited companies, so that's something good. National, and again we have got Abbott Laboratories. It's a multinational. Martin Dow Pharmaceutical Pakistan Limited. You can see the word limited. You can recall some of the previous concepts that I've identified to you. National companies, serial companies limited, national companies again. Sanofi, uh, Sanofi Aventis, it's a multinational. OBS Pakistan Limited, it's a national. So you can see that the top 10 companies include one, two, three, and four multinational, and there are six national companies that are working around. Right. Then if I move forward, it says salient features of the pharmaceutical industry. Now let's look at some of the most important features of this specific industry. Remember, in order to increase the sales of the medical product, you need to provide sales incentive to the salesman. Now you must have seen going to a doctor, and you must have seen some sales representative selling their pharma products or pharmaceutical medicine to the doctor so that they can recommend it to their patients. So yes, some of the sales incentives are given by this industry so that to make the sales of this industry to be better one. Then it says that payments to Drug Regulatory Authority of Pakistan. Yes, DRAP, one of the most important authority that regulates the drug. Drug obviously means the medicine industry. So it regulates the drug of Pakistan, how they are being produced, how they're being made. It says that there are certain special payment made to DRAP for various purposes, including the Central Research Fund annual levy of 1% of the profit before tax. So 1% of the profit before tax is being sent by every pharmaceutical industry to DRAP for the purpose of making the research in pharma industry to be better. New drug registration fee. Whenever you introduce any sort of new medicine, you have to pay a registration fee for that as well. Drug registration renewal fees in order to work in Pakistan. If you want to sell your medicine in Pakistan, you'll have to pay a renewal fee every single year. Drug manufacturing licensing fee, and obviously if you are manufacturing a drug in Pakistan, so it has to go through different stages of quality checks along with the health and safety standards are being maintained and not. So you will only be getting license for obviously for in return for the fee, only if you are maintaining that specific international quality of a drug being used for health and safety standards. Then it says that the payment of healthcare professional, we are not only paying to the to the salesmen, but we also pay to the doctors so that they can contribute their input in making the pharmaceutical industry to be better one and to moving forward with the pharmaceutical industry. Then we have the scientific information. Obviously, research is not free of cost. Research and development sector will have to have a huge amount of cost being invested in it, and once the cost is being invested, it will be better objective for the company to generate sales. Clinical trials, yes, before the actual um, product being introduced in the market and being used for the health and safety purposes, you know it very well that we go for the clinical trials. Now, what are the clinical trials? Clinical trial means that before any drug being used, any medicine being used for the purpose of health and safety, what we do is we try to we try to ensure that that specific drug or that specific product is in greater use for the company and is in accordance with the health and safety standards. Moving forward, it says, what is the role of the pharmaceutical industry in Pakistan? And let's look at some of the opportunities and threat. Acha, one more thing, I don't think so that there might be many questions being asked from this section. They might ask you about the pharmaceutical industry, the thing that we have, the area that we have covered right now before the 1.2 section. But let's just quickly go through this as well. It has lesser chance of being tested in the real exam paper. So it says the role of pharmaceutical industry. What are the opportunities and threat? No healthcare system in the world can deliver treatment and care the patient without supply of quality medicine. Both the healthcare system and pharmaceutical industry need to work together in ensuring the affordability of healthcare for all. Let's look at some of the most important opportunities of healthcare, and we'll be going for the threats as well. It says market attractiveness. Pakistan large population and suboptimal access to quality medicine and high disease burden offers growth of opportunities to pharma industry. Yes, in Pakistan, you know it very well that we are an underdeveloped nation. We are trying our level best to get out of the day-to-day consequences of lesser side of the health and safety, but still, due to the fact that there are many diseases and high burden of diseases are being occupied in Pakistan. So yes, the pharmaceutical industry find this to be an opportunity for their research and manufacturing, and ultimately this opportunity, if materialized in the optimum manner, will give them the market attractiveness. And then what it says is, what do you mean by export potential? According to McKinsey's study, with certain deregulation, Pakistan export potential could reach $1 billion, which is currently less than $200 million in Pakistan. Currently, we are exporting around $200 million, but it says McKinsey says that some of the deregulations, if being applied, the Pakistan pharmaceutical industry can export up to $1 billion per annum. Obviously, um, India pharma export are more than $20 billion. So India have been very reliant on pharma industry. Pharma industry in Bangladesh and India are growing with export more than 10 times than Pakistan. We have the ability, infrastructure, and human resource. We need to optimize a regulatory policy. If you go back to the history, you must be very much amazed that in Pakistan we have got scientists, we have got individuals who are working day in and day out, and majority of the medicines, majority of the pharma industry revolutions are being created by Pakistani scientists. So that's something which is important, but to utmost disappointment, Pakistan pharmaceutical industry, if being regulated with good policies, it can generate tremendous amount of revenue, and this 1% GDP inclusion can be more than 40 to 50% as well. Bangladesh and India have many food and drug administration authorities approved plants. However, we do not have a single manufacturing plant that is FDA approved. FDA means that there is a food and drug authority. There's an authority that regulates the food and drug, obviously, but it's an international authority. However, in Pakistan, we do not have such approved authority working. This impedes our export potential in developed market. Now, what are the challenges of pharmaceutical industry in Pakistan? Yes, there are certain challenges, but let's just quickly go through them so that we can have a good, better insight of what challenges to pharmaceutical industry. Now, over here it says that what are the challenges for a pharmaceutical industry? So let's just quickly go through some of the major challenges of pharmaceutical industry. The most important challenge of pharmaceutical industry is price control. Now, pharma industry is largely import dependent industry. Continuous weakness of Pakistan rupees have resulted in high inflation. Obviously, if we are buying materials from USA or any other economy, we know it very well that we have to go through some of the inflationary impact in Pakistan on daily continuous basis, together with high utility cost, such as environment price control, hurts margin and industry attractiveness. Low margin makes certain medicine not viable to market for pharma companies, and they stop making them, and that result in shortages of medicine and distress to patients. Several multinational companies have excited because of low margin, exited because of low margin. So there are certain multinational industries in Pakistan who have exited because of low margins in Pakistan. Recent introduction of inflation indexation pricing was welcomed by the industry. However, new changes in price control would hamper timely price adjustment. Now, this means that in pharmaceutical industry, the government is regulating the prices, and they have introduced the concept of minimum prices. I hope so. You must have gone through the concept of minimum prices in the book of economics. You know it very well that minimum price are above the equilibrium point, and pharmaceutical industry is regulating their industry by setting some of the minimum prices for the market. Delay in new medicine registration. It takes significant amount of time of registering your medicine in the authority that operates in Pakistan. It takes significantly longer time to obtain registration for a new research-based product. Delay in registration adversely affect patient access to more effective new treatment. Delay also impacts profitability due to rupee erosion, increasing import cost. Companies sometimes do not launch these products. Patients end up paying higher price for those medicine coming through the gray channel. So certain times we do not get the desired medicine, and what do? We go for black market where the medicines are being overpriced and sold at a black economy or black market. Price adjustment for the new medicine for increase in import cost would ensure the fair margin and incentive to introduce new research-based medicine that will be beneficial for the patient. So, if these prices are being regulated properly, honestly speaking, the entire Pakistani market is going to get a better life thereafter. Sourcing APIs and therefore let's just eliminate this one. I don't think so that there is any chances of this being asked by the examiner. So yes, thank you so much. I've gone through the pharmaceutical industry. Now we are just left with the oil and marketing industry, and that I'll be going through in my tomorrow's lecture. Till then, take care. Bye bye.